chemotherapy-induced peripheral neuropathy, which is CIPN. And there are certain signs and symptoms that I want you to be aware of, because if they get worse, then it means your disease is progressing and we might have to change the treatment. So if your pain gets worse, you mentioned that you have pain, definitely let me know, let your physician know, and we'll do something about that. Also, peripheral neuropathy affects the nerves, like in your lower leg, and there are two types of nerves, motor and sensory. So your sensory nerves could be affected, meaning you can't feel things as much. Your foot, you might not be able to know if, might not be able to feel the rug versus the carpet versus the tile. Or that might not be seem that important, but it is, because you could be walking with a rock inside your shoe all day, not know it, come home and have a bloody toe. And that could lead to other problems, infections and stuff, and we want you to be careful about that. Also, motor-wise, it could affect the way your leg's moving, the way your foot's moving. It might be weaker. You might not be able to pick up your foot as much anymore, and that could cause you to lose balance and stuff. Overall, if your nerves are infected, most likely your balance will be affected, and that's something I really want you to pay attention to. If you're noticing that you're stumbling a lot more, or you're falling, that could lead to hospitalization and treatments for so many other things, and we want you to be careful of that. If you notice that, let me know, let your physician know, and we'll change the treatment. I can change the way we're exercising, focus more on the stuff you're having difficulty with, and your physician might recommend you to other professionals, other medications and stuff, and that could be something that we might have to look into. Okay. If your balance is affected, so will the way you walk. So if you wake up one day and notice that you feel like your walking is a little off, or you're moving a little differently, or someone even comments, like, oh, you're walking a little funny, don't brush that off. That might be something that we might have to look into, and that's something I can help you with. All right, so let me know about that. Mm-hmm. One last thing, you'll find motor control will be affected, and that's like the movement in your fingers and your toes. So if you're noticing you're dropping things a lot more, or if your handwriting's off or something, that might be the fine motor control. And again, that's something that we can work on. So if you're noticing any of these signs and symptoms, you definitely need to let me or any other healthcare provider you're with know, so we can treat those. All right? Now, because you are more prone to falling, you have impaired balance, there are certain measurements that you're going to have to take yourself to be careful of. For one, you're going to have to take you should do a foot exam daily. All right? That includes, you have the range of motion, you're able to bring your foot up, so go ahead and show me over here. Bring your foot up like this, and you can see, just feel it around, do you have any cuts or bruises that you did not expect. Make sure you're moisturizing, keeping your foot healthy. If you can't do this, you can find a small mirror like this from any departmental store, and they have certain ones that you can put down below your foot, just to be able to check. If you're finding any bruises you didn't know about, any cuts you didn't know about, you should definitely be careful of those, because that could mean that your disease is progressing because you didn't know it. Okay. Also, there are certain things that you could be falling over, like you mentioned your kids at home. Make sure they're cleaning up after themselves. If there's a toy on the floor, you might not have the strength to step over it, or you might not be able to see it, you can't feel it. You're more prone to falling over it, and again, leading to other things. So, and if you have like rugs and stuff, that's something you want to be careful of. Do you have any other questions?
Yeah, I noticed that I was starting to get dizzy in the bathroom.
The bathroom?
Yeah.
Well, there are certain things that we can solve for you in the bathroom, like handrails or like grippy stuff on the floor to like make sure you're not falling. So let me know what the problems you're having, and I can show you a brochure that we have in our clinic, and then you can see whatever you need, and we can work on getting stuff for you.
All right, thank you.